I'm a transit planner in Tokyo, and last year an American consultant joined our municipal safety committee. During his first meeting, he insisted we install panic buttons in every subway car. When we asked why, he said, "You need emergency alerts for when someone pulls a weapon." Our department head looked confused and asked what kind of weapon he meant. The American looked genuinely surprised and said, "A gun, a knife, whatever. You know, for active shooter situations on trains." He seemed convinced that mass transit required armed security protocols as a baseline safety measure. When we explained that violent crime on Tokyo trains was nearly non-existent and that Japan recorded essentially 0 gun deaths annually, he shook his head and insisted, "Just wait until something happens. Prevention is better than cure." He then proposed we hire armed guards for platforms, install bulletproof glass in ticket booths, create lockdown procedures for stations. The department spent 3 meetings trying to explain our actual safety concerns, which mostly involved preventing people from jumping onto tracks. During rush hour delays and managing lost children at transfer stations, I manage a youth hostel in Reykjavik. An American family checked in last month and immediately asked where the safe neighborhood was. I asked what they meant, and the father explained they needed to know which areas to avoid after dark. I handed them a city map and he interrupted me to ask, "But where's the bad part?" His teenage daughter chimed in, saying she'd researched online and found that Reykjavik has downtown areas, so there must be dangerous zones. I explained that Iceland has one of the lowest crime rates globally, and the mother looked skeptical. She asked about muggings, carjackings, and gang activity. When I said we essentially don't have those issues, the father insisted I was being polite to avoid scaring tourists. He said, "Every city has crime. That's just reality." They spent their first evening walking only on main streets with bright lighting, clutching their bags, and returned to tell me they felt surprisingly safe, as if they'd discovered something I'd been hiding from them. My sister runs a pharmacy in Zurich. An American exchange student came in asking for pepper spray, a taser, and a personal alarm. She explained these items as basic safety gear for walking home. My sister asked if she'd experienced any threats. The student said no, but insisted, "I'm a woman living alone in a city. This is non-negotiable." When my sister explained that pepper spray requires a permit in Switzerland and tasers are restricted, the student became visibly anxious. She asked how Swiss women protect themselves, genuinely confused. My sister mentioned that violent street crime is rare here, and the student responded, "But what about at night?" She couldn't comprehend that Zurich streets remain safe after dark, insisting that darkness automatically equals danger in any urban setting. Let's explore how people in the world's safest cities actually view American safety culture, urban design, and daily security concerns. I work at a community center in Singapore's Ang Mo Kio district. An American nonprofit director visited last year to study our neighborhood programs. During the tour, she kept asking about security measures. When we reached our children's playground, she stopped and asked where the perimeter fencing was. I explained the playground is open to the park, and she looked alarmed. She said, "But how do you control who enters? How do you screen people?" When I explained that community spaces are publicly accessible and monitored through social cohesion rather than physical barriers, she insisted this was irresponsible. She mentioned that American playgrounds require controlled access to prevent kidnappings and assaults, citing it as standard child safety protocol worldwide. Her entire report later criticized our lack of basic security infrastructure, recommending we install card access gates, security cameras with facial recognition, and mandatory adult verification systems. My brother is a police officer in Abu Dhabi. An American security consultant came to our station, offering to train our force in tactical urban response. During his presentation, he emphasized the importance of officers maintaining a defensive posture during routine interactions, keeping hands near weapons, and treating every public encounter as potentially hostile. Our commander asked why such extreme caution was necessary when Abu Dhabi has minimal violent crime. The consultant insisted that complacency leads to officer deaths, citing American statistics about police fatalities. He claimed that universal threat assessment is a fundamental principle of modern policing, regardless of local crime rates. When our commander explained that Emirati police prioritize community relationships over defensive tactics, the consultant dismissed this as dangerous idealism. Spent 20 minutes explaining why our officers were inadequately trained because they don't practice contact and cover positions during traffic stops. I teach urban planning at the National University of Singapore. An American colleague joined our department last semester and immediately criticized our public housing model. During a faculty meeting about neighborhood development, she insisted that concentrated public housing always creates crime corridors, and that Singapore's HDB estates must have hidden violence. When I explained that our public housing hosts over 80% of residents with excellent safety records, she said that's impossible. Affordable housing attracts crime. That's Urban Planning 101. She claimed that American research proves economic diversity in housing leads to increased theft, assault, and drug activity. She even suggested that our low crime statistics were manipulated by the government, because actual density mathematics shows that putting many people in proximity inevitably generates violence. She couldn't accept that different urban design philosophies produce different outcomes. I'm a night shift manager at a Copenhagen hotel. An American businessman checked in and immediately asked about the hotel's security protocols. He wanted to know response times for emergencies, whether we had armed security, and what our active shooter procedures were. When I explained that Danish hotels don't typically have such protocols, he looked genuinely frightened. He asked, "What happens if someone comes in with a gun?" I explained that civilian gun ownership is rare and gun violence essentially doesn't occur in Copenhagen's hospitality sector. He insisted that hotels are prime targets and referenced several American hotel shootings as evidence of universal vulnerability. He mentioned that this is why American hotels train staff in barricade techniques and have partnerships with SWAT teams. He spent his entire stay keeping his door bolted and furniture pushed against it, later writing a review warning other Americans about our non-existent security measures. My wife works as an emergency room nurse in Oslo. An American medical student rotated through our hospital last year. During his first shift, he kept asking patients for insurance information and payment details. When my wife explained that Norwegian healthcare is universal and treatment isn't contingent on payment verification, he looked confused. He asked, "But how do you prevent people from abusing emergency services?" She explained that providing care is the priority, and he insisted this must lead to system exploitation. He claimed that without financial barriers, people use emergency rooms for minor issues, citing this as basic healthcare economics. When my wife mentioned that universal access actually improves public health outcomes and reduces costs, he dismissed it as unsustainable socialist theory. Couldn't comprehend that Americans spend more per capita on healthcare than Norwegians while achieving worse health outcomes. A general practitioner in Vienna, an American patient registered at my clinic after relocating here. At her first appointment, she brought a folder of medical records and looked nervous. She kept apologizing for taking up my time and asked multiple times how much the consultation would cost. When I explained her visit was covered by Austrian insurance, she asked about co-pays, deductibles, and out-of-pocket maximums. I clarified that she would pay essentially nothing for the appointment, and she started crying. She said she'd been delaying checkups for years in America because routine care costs hundreds of dollars even with insurance. She mentioned avoiding specialists because visits required referrals that cost money, and treatment plans became unaffordable. When I prescribed medication, she asked how much it would cost, and I told her probably 8 to 12 euros. She looked shocked and asked if I meant per pill, and I explained that was the total cost for a month's supply. She couldn't believe that healthcare could function without creating financial anxiety. I manage a medical clinic in Taipei. An American exchange professor came in with a minor infection requiring antibiotics. After examining him, I wrote a prescription and mentioned the total cost would be around 900 Taiwan dollars, roughly $30 US, including the consultation and medication. He pulled out his credit card and asked, "Is that my copay?" When I explained that was the entire cost, He asked where he submits claims to his insurance. I clarified that Taiwan's healthcare system charges fixed, affordable rates and his total responsibility was $30. He insisted there must be hidden fees, demanding an itemized bill showing facility charges, provider charges, and pharmacy charges separately. He couldn't grasp that quality healthcare might cost less than an American restaurant meal. Insisting that real medical care requires the four-figure bills he was accustomed to paying in the States. My cousin is a hospital administrator in Copenhagen. An American healthcare executive visited to study Danish hospital management. During her facility tours, she kept asking about our billing department size. When my cousin explained we have minimal billing staff since healthcare is government-funded, she insisted we were hiding information. She said hospital billing is the largest administrative expense. Where's your claims processing center? She claimed that American hospitals require hundreds of billing specialists to manage insurance negotiations, payment collections, and denial appeals. Asserting this is a universal healthcare reality, when my cousin showed her our actual administrative structure, which focuses on patient care rather than payment extraction. She called it financially impossible. She spent the rest of her visit trying to locate our hidden revenue cycle management team. Convinced that efficient healthcare delivery without massive billing infrastructure violated fundamental hospital economics. I'm a cycling instructor in Amsterdam's public education program. An American urban planner spent 2 weeks observing our bike infrastructure. He repeatedly insisted that separated bike lanes are nice luxuries rather than essential transportation infrastructure. During a presentation to city officials, he claimed that bicycle commuting only works in small European cities and suggested we invest in highway expansion instead. He cited American research showing that bikes can't be primary transportation because people need cars for groceries, commuting, and family transport. When officials mentioned that over 60% of Amsterdam residents commute by bike regardless of weather, kids, or cargo needs, he said we must have exceptional circumstances. He claimed that replicating Dutch bike infrastructure in American cities would fail because Americans have different transportation needs and require personal vehicles. He couldn't accept that car dependency is a design choice rather than an inevitable urban reality. My father drives buses in Munich's public transit system. An American tourist approached him at a major transfer station looking panicked. She asked where to buy day passes and how the fare enforcement worked. When he explained the honor system, where passengers purchase tickets without barriers but risk fines if caught without valid payment, she looked horrified. She said, "People will just ride for free. How does this possibly work?" He explained that most people follow the rules and periodic inspections ensure compliance. She insisted this proved Europeans are more honest than Americans, and that such a system would face complete fare evasion in U.S. cities. She claimed that Americans would exploit any system without physical turnstiles, citing this as a cultural difference. She couldn't comprehend that fare evasion rates in honor-based systems often match or beat barrier-based systems because the design assumes civic responsibility rather than criminal intent. I work at a transportation planning office in Tokyo. An American consultant reviewed our station accessibility features. He praised our infrastructure, but insisted we needed more last-mile solutions, specifically parking structures near every station. When we explained that Tokyo's transit philosophy minimizes car use by making stations accessible via walking, cycling, and buses, he said we were forcing people out of cars. He claimed that Americans value freedom of vehicle choice and that efficient transit should accommodate drivers parking and switching to trains. He insisted that Tokyo's transit ridership, the highest globally, would improve further with massive suburban parking facilities. We tried explaining that reducing car dependency is intentional design. It's creating walkable neighborhoods where residents don't need vehicles. He dismissed this as anti-car ideology that wouldn't work in freedom-loving cultures. Unable to recognize that car dependency is expensive, unhealthy, and environmentally destructive. My husband is a traffic engineer in Zurich. An American delegation visited to study our urban mobility plan. During discussions about our goal to maintain 30% of trips by car or less, one delegate asked where we were building new highways. When my husband explained, "We're not expanding road capacity," the American looked shocked. He said, but your population is growing. Basic mathematics dictates more roads. My husband mentioned that we're investing in transit, cycling, and walkability instead, and the delegate insisted this would create traffic gridlock. He claimed that road capacity must grow proportionally with population, citing this as fundamental traffic engineering. He mentioned the American approach of adding lanes to reduce congestion, seeming unaware that more roads induce more driving. When my husband mentioned induced demand, the American dismissed it as environmental propaganda. He spent the rest of his visit drafting unsolicited highway expansion proposals. Insisting we were ignoring traffic science, I run a visitor center in Reykjavik. An American couple stopped in yesterday asking for a city safety briefing. They wanted to know protocol for random violence, areas where tourists get targeted, and what to do if threatened. I gave them a standard welcome map, and they seemed disappointed. The husband asked, "But don't you warn people about anything?" I explained that Iceland has virtually no violent crime, and visitors mainly need to watch for weather and natural hazards. The wife said that can't be the whole story, as if I was deliberately withholding danger information. They left seeming almost offended that I hadn't validated their safety concerns. Unable to process that some cities genuinely don't require constant threat awareness. Maybe the real culture shock isn't experiencing a safe city, but realizing that fear-based urban use living isn't inevitable everywhere.